Good evening and welcome to another episode of ThePrint's Virus Decode, where experts from across the country answer your questions regarding COVID and the pandemic. India is still seeing a rise in its COVID numbers, with active cases having crossed 18 lakhs as of today. But major metros like Delhi and Mumbai are seeing some signs of infection numbers peaking. But this wave is not over yet, and with high number of people getting infected, uh, there is still a lot to know about this virus. To answer all of your questions today around COVID numbers and the infectious diseases, we have with us Dr. Chandrakant Lahariya, an epidemiologist and a public health policy expert. We're also waiting for Dr. Kirti Sabnis, infectious disease specialist at Fortis Hospital, Mulund and Kalyan, to join us. She will be with us shortly. Along with that is my colleague Sandhya Ramesh, who tracks science stories for The Print. Thank you for taking out time to be here today, and thank you to the viewers for waiting and for joining us. But before I go to viewer questions, I'll come to you, Dr. Chandrakant. This is the question that everyone has. When will this end? Are we any close to the peak?
Thank you very much and good evening. So as a medical doctor, epidemiologist, we really do not like making prediction. But we all are so much tired of this pandemic, like 2 years, that everybody want to take a risk, and I want to take a hazard guess. And what we are hearing, informed guess, and especially when you are trained as epidemiologists, you are trained to make inference based upon limited information. And on that basis, what we are hearing, that we can say confidently that provided some situation, provided the caveat of there is no new variant which is more transmissible, and provided that we can ensure that vaccines are available to a wider section of population, the vaccine inequity is addressed, we definitely see a hope that by mid of this year, the world would be out of the pandemic. Having said that, I want to say that we will be out of the pandemic sometimes this year, probably mid of this year, but we have to live with the virus. So we would be continue to see number of cases of COVID-19 or SARS-CoV-2 in different settings, but that would be acceptable number of cases which might vary from each setting. So countries would determine that what is the acceptable level of cases for them to declare endemicity, but world is, we all hope, would be out of pandemic by mid of this year, but definitely by end of this year.
Right. You are actually the second expert to have said this on our show. And I would want to add to this that, of course, these, estimates come with the rider that the response to the pandemic, the response to the spread of infection is also taking place for, these predictions to sort of come true. If Dr. Sabnis is, I think she has joined us, and so I would like to address, I'll go to her with my next question. Are you seeing a lot of patients who are vaccinated and coming into the hospital with severe disease? So, how do you tackle such cases? Do you talk about why they haven't taken their vaccine yet, or how do you address vaccine hesitancy in that?
So vaccine hesitancy is mainly related in people who have had a few reactions or who are on multiple medicines. So actually we need to readdress the fears by discussing them about the vaccination effects. And now the data is wide available that people who are unvaccinated are actually the people who are having complications with current wave. People who are vaccinated are not having the complications, at least requiring oxygenation, going up to the ICUs, is hardly seen in people who are vaccinated well. So giving these examples, it is easier to convince people that the vaccines are safe and effective, at least to prevent complications, even with the new variants coming up.
So, right. So the people who do come with severe disease to your hospital, are they more usually the ones who are not vaccinated?
That's a very good question. See, we don't have all the patients who come to us. It's not by default we have that vaccine titers antibodies done. But people who are either not vaccinated, because previously in pregnancy it was not recommended in initial phases, so that those are the one patients who come. Second, people who are on multiple chemotherapies or immunosuppression post transplant, by itself the vaccination producing effective antibody is less. So these kind of patients are coming and are having majority of the complications. Otherwise, the healthy people who have taken 2 vaccines are relatively safe in this way.
All right, that's actually quite good to hear. I mean, that this is the kind of thing that we're hearing from a lot of doctors around the country, that because a lot of people have been vaccinated, have gotten both their doses, the disease is not progressing to severe stages as we had seen with the Delta wave. Coming to you, Sandhya, what I want to ask you is basically a viewer question that I was not able to take yesterday. And that is, how relevant are masks? I know that this is something that we have constantly talked about, but I think the question comes at this point because people who reportedly took all precautions are still falling ill. So in that context, how relevant are masks?
Well, masks today are one of the most important tools that we have to fight against the virus. But we also have to remember that they don't work alone by themselves. They are also accompanied by the other things that we have to remember. The easiest is the 3 C's, where you avoid close contact. So you maintain physical distancing, and you also avoid closed rooms. And then, of course, you also do wear masks. So it's a combination of all 3 of these. So what happens is, even when someone is masked, the risk of transmission goes up if there is close contact in an indoor setting. So everything is variable on a meter of these 3 parameters, and that is something that we do need to remember. But that said, mask is the most efficient tool that we have to prevent the inhalation of virus. We know that the virus is not spreading through any other means. We do know that there is airborne transmission. So the best thing we can do is to prevent inhalation of the virus. And it's not just any kind of masking. When we suspect that there might be increased risk, we also have to double mask. So you wear the more protective mask underneath and the less protective mask outside. And of course, now experts are recommending that everybody wear the N95. So masks, very much one of the most essential and important items in our toolkit against this virus.
Right. Thank you for that, because we know for 2 years that is the one piece of advice that has not quite changed. Like there was a bit of confusion right in the beginning about who should wear masks and what kind of mask to wear. But now I think we do have scientific consensus on this. Coming back to you, Dr. Chandrakant, from the public health policy perspective, we do still have a lot of questions around how to go around targeting that remaining section of the population that is still not vaccinated. Do you think the way to tackle this vaccine hesitancy is by mandating vaccines? Should there be, an order or a law saying that everyone has to get this vaccine?
So this issue of mandatory vaccination is as old as the vaccines. Like starting early 19th century, there was discourse and deliberation that vaccine should be mandated. But what we need to remember that even in the scenario of mandatory vaccination, there were always exemptions on the philosophical, scientific, or religious grounds, and those people will be let go with a counseling. So mandatory vaccination never meant in the history of vaccination that everybody should be vaccinated irrespective of their will or not. That's one part. Second part is that we need to remember whenever any such vaccine mandate is being planned, that COVID-19 vaccines are different from rest of the vaccine. These vaccines definitely have a proven individual benefit. If you give vaccine, person will be protected from severe disease, hospitalization, death. And that's absolutely fabulous, true for all vaccine and continue for a longer period. But when it comes to public health benefit, which is in the terms of reducing transmission or reducing infection, the benefit of currently available COVID-19 vaccines is variable. For example, there is more evidence available for mRNA-based vaccine. We know through epidemiological study that they reduce transmission, but we do not know that how much transmission is reduced by Covishield or Covaxin, because each vaccine is different. theoretically or by immunological principles, we know that because somebody develop antibody, that person is likely to have a less transmission. But going by the evidence that even those who receive 3 shots of vaccine, there is a widespread infection in all those countries which have administered booster. The public health benefit is really limited. So when the individual benefit is high and public health benefit is limited, I don't see much of the value in making vaccines mandatory. Final point I want to make in the last 30 seconds is that even in the mandatory vaccination, every country context is different and epidemiology context matters. So what is true applicable for France or Denmark or Italy is very different from what is true for India. And then a final point is that we need to remember that even when making mandatory, the essentials of life, like access to salary, job, or other thing cannot be denied, while the non-essential, which we can say going to bar, playground, play, otherwise those things can be restricted for some time, not for longer time. So essentials and non-essential should be separated. So it's a more nuanced debate.
Right. That this actually, I want to ask a follow-up question to Dr. Sabnis. When we talk about jobs and essentials not being made dependent on whether or not your vaccine has been whether you have been vaccinated, but in context of healthcare workers, do you think it in that context it should have been something that gets mandated, because not only is their work essential, their presence and the fact that they stay healthy and protected was very essential to tackling the pandemic?
That's a very appropriate question, Mona. But in healthcare workers also, there can be few contraindications, like if the healthcare worker had a previous reaction to any of the vaccines, or if healthcare has some immunocompromised condition, like healthcare worker can be post-transplant or might not be able to take all the vaccines. So it becomes difficult, and it has to be made an individual basis whether the vaccine is appropriate and mandated. As we say, healthcare workers are most commonly getting the brunt of the infection, but there are only vaccines are protective definitely from the severe infections, but they are not going to prevent the infection 100%. So mandating the vaccination in healthcare workers becomes difficult if the healthcare workers also have some underlying health issues. So I feel it has to be made case by case basis. And as healthcare workers, most of the healthcare workers, doctors and nurses, are aware about the side effects and benefits of the vaccination. So like in our hospital, the vaccination rate is almost 99%. Everybody has taken, except few are in first early months of pregnancy or few previous vaccine reactions. So I think that itself, creating awareness will help for long term.
Right. I'm going to start taking a few viewer questions. I have one question from Tirumal on Twitter. He's asking that, China says that foreign parcels spreading Omicron in the country, overseas parcels may have spread the Omicron variant in Beijing and elsewhere. Sandhya, I think you should take this. I mean, the question is about whether, droplets on parcels can spread a variant from one country to another. Is that possible?
Well, so, Mohana, actually, you and I did a long explainer on this last year. And with all the data that we have right now, all the scientific studies we have and the real world scenarios that scientists have studied, with all of this data, we can tell fairly confidently that the risk of fomite transmission or surface transmission is very, very low, or at least up until the Delta variant. To be fair, there haven't been studies specific to the Omicron variant, but there's nothing to indicate that this is going to be any different, because we already know that this variant is highly transmissible and through airborne means, like all of the other variants do. So there's nothing really to indicate that there is a parcel or surface contamination, fomite transmission, that is occurring. Most likely, it's the packages that are being handled by people who might have been infected, and it's close contact settings that would have spread the virus more than fomite transmission. The risk from surfaces at this moment, we're pretty certain, is really, really low.
Right. And, this is, again, one of those things that was really talked about in the early stages of the pandemic, where There was a lot of focus on disinfecting surfaces, but we later did find out that it's aerosols that are causing most of the transmission. So in that context, Dr. Chandrakant, when we talk about policies and public health measures to prevent infections from spreading, we do see that there are a lot of challenges in how the science gets communicated to the public and even to the health authorities or the civic authorities. So can you share some of the learning experiences, or what are the kind of things that you think was different for this pandemic, or that either made it more challenging or maybe made it easier to communicate?
So one of the challenge which we have recognized in this pandemic and which was different from all previous pandemic, last one was in 2009 and 10 H1N1 swine flu, so not long ago. But this pandemic happened in the time of social media, like the Twitter, Facebook, and all other social media and other platforms were not that much predominant at a decade ago. So this is the first pandemic in era of social media, and that means many of the information which are passing on very quickly across the world, and the misinformation or the infodemic which happened was as big a challenge as a virus, as the World Health Organization had said. So alongside other thing is that what we have been I've been engaged in some of the discourses that the governments are unfortunately not trained to do a timely, transparent communication. The medical doctors and health experts are not trained to communicate to the public in a short and succinct way. The real life scientific research published on a preprint server was being interpreted by amateurs and social media, which also caused the panic. And then influential individual who had no understanding of the topic made their own inferences. So there have been many challenges in this pandemic, misinformation, infodemic. And then the decisions were not always taken on the scientific evidence. To put this together, in my opinion, one of the biggest learning from this pandemic is that while providing health care or other things are important, communicating science to general public is so very important to fight the diseases, outbreaks, epidemics, pandemic. Training the health experts and training especially government officials in communicating science is so very important. I also think, and I have written about this in the past, that this pandemic reminds us that media and health experts need to work together. Health experts need to learn from media how to communicate, and media also need to learn from health experts to pass on the right scientific information. So there are many learning which we should not wait for pandemic to be over and then only will be utilized. We should be working on those learning now onward.
Right. In fact, over the last few days, there were a couple of videos that went viral where we see people in rural India, basically just running away from healthcare workers who are trying to give them the vaccine. And there was one today where I could hear someone from the background just saying that you have to take the you have to take the vaccine, and this man just, getting quite violent and just running away. And people may laugh about it, but it is actually a very serious and sad state of affair that in a era when we claim to be completely connected and there's so much information and access to information, there's still pockets where the information has been so hard to reach. Coming back to you, Dr. Sabnis, in the last wave, we did hear a lot about concurring infections, and I'm not just talking about like two viral infections. There was black fungus as well, which of course made the big news. But there were other infections like the drug-resistant Candida auris, which is a type of yeast. And are you seeing similar incidents in this wave? Are such cases still being seen in the hospitals?
This is a little too early in the pandemic. There is few cities like Delhi, Mumbai are reaching their peak. And as we go ahead in the pandemic, we will be able to completely say whether we are going to see any additional infections. See, these infections are mainly because of prolonged stay in the hospital, number one. Second is because of prolonged and heavy use of steroids. Number two, and uncontrolled underlying conditions like diabetes. So I think we have learned from the first and second wave that the steroids help only when there is oxygen is low. So overall, the physicians and intensivists across the country are little wary about the use of steroids when it is not indicated, and people are aware about their underlying condition, are controlling their underlying diseases better. So far now we are not seeing the increased infections in mainly invasive fungal or bacterial, because overall vaccination population is fighting the disease better, and they are not staying longer in the hospital as they used to stay before.
Right, that is actually a very good point. I mean, in the second wave, one of the major reasons we saw that black fungus epidemic, if I should call it that, it was about healthcare workers not being able to cope with the huge number of cases as well. So that did lead to a lot of patients being treated in less than ideal conditions as well. So that was one of the concerns. And since we are seeing lesser number of severe cases in this one, so we hope that that, as you said, like we were, yeah, fingers crossed, right? Sandhya, coming back to you, what Dr. Chandrakant said about communication. I mean, I have had some experience dealing with public health authorities and how they disseminate information. You too have had that. Would you like to comment a little bit about how challenging it has been to get some basic information and data from the officials in India?
Well, the challenges come from both directions. One is it is hard to get information from health officials. A lot of the times there is a process that is followed, and then when there are guidelines released, that is typically when you get to understand what the ministry or the government is thinking. But I think the more pressing challenge is also for people to understand what the ministry guidelines are trying to say and what the science is trying to say here. So the science is moving really, really fast. And while it's hard already for scientists to keep up, for everybody else, it is even harder to keep up. So when there are certain guidelines that are being introduced, it makes a lot more sense to also inform the public as to why and how they work. I think that is one thing that probably should be coming from the top down, and leadership across the world, not specific to just India. Everybody should be instilling a little bit of scientific logic into what the reasoning behind all of these new developments and guidelines are, so that it's easier for people to follow them. And we find that a lot of the times, even the guidelines themselves do not stick to the science. For example, we know that while the wave is still spreading, so in some places there are outdoor activities that are banned, but then we know that closed theaters and pubs are allowed at 50% occupancy, even while Omicron is spreading and night curfews are being enforced. So it's really important for these guidelines to go hand in hand with the science, and getting that kind of information specifically is more difficult from authorities because there is a certain level of mismatch with which we are catching up with the science, for sure. And this does also directly trickle down and have an impact with the public, who aren't a lot of the times understanding how and why certain guidelines are being implemented.
Right. That's actually right. I mean, I do feel that there are times when I think even from doctors as well as health authorities, when it does feel like not enough information or not enough reasoning or answering is given for basic things, which makes it more difficult to communicate to the public as well. Dr. Sabnis, when you talked about patients who are immunocompromised, who have already taken 2 doses but still don't have sufficient antibodies. So do you think that it's time for India to sort of open up boosters for such patients as well, even those who are below 60?
Actually, yes. people who have an antibody titer is not only measure of your immune function. There are many other ways the immunity works, which we sometimes can't measure. But in general, these people have lower generation of both kinds of immunity, as well as they are likely to have higher chances of going into complications if they get COVID. So I think it's a time that we should start vaccinating before another wave comes, because we can't predict whether that is going to come or not. So we should vaccinate our immunocompromised population less than age 60, definitely.
Right, and in fact, Tila, that's what what happened. We waited a lot on the boosters, on taking a decision on the boosters, and by the time that decision came, Omicron was already widespread in the country. Closing comments from you, Dr. Chandrakant. What as an health policy expert would you say to the public at this moment? We are we're better equipped at fighting this pandemic than we were in the last wave, perhaps. But what are the precautions that we still need to continue to take?
So I would like to go to the question on boosters before I come to this one.
Right.
I think the booster debate is really more nuanced in India, and we need to remember that vaccines are different and every country context is different. So India is not following and need not to follow what other countries are doing on the booster. That's one part. India's vaccines are very different. There's a different role. So in my opinion, the current policy of opening booster for health worker, frontline worker, and high risk population is good. Only exception I would say that it should be all elderly beyond 60 years. As far as younger than 60 is concerned, I think the debate on booster need to be made further nuanced. The reason being that with the Omicron wave going on, there is a fresh exposure, and we believe that in the current wave, the exposure of population would be far greater, and that would work like further boost the immunity of the people. So I really do not know, but I think for a few more months, India might not require booster for healthy adult younger than 60. That is something going to happen. What policy or what people need to follow? A few things. One, I think there is enough scientific evidence and learning about Omicron. There is no need to worry or panic. Just don't look at the numbers, how many cases are being reported. What we are concerned in this pandemic, that how many of those infections are getting translated into hospitalization and ICU admission, and that proportion is really, really small. So we need not to worry about the pandemic or wave. That's one. Get vaccinated if you have not already been. Get precaution shot if you are eligible. Two things to remember. Masks are really very important, as Sandhya ji has already highlighted. And other thing is ventilation. We need to focus upon that, whether we are every decision which as an individual citizen somebody is going to make that wear right kind of mask, a better mask than we were wearing earlier, and make a decision whether you are going to open space. You can go more easily to open spaces. If you have to go to indoor space, follow COVID appropriate behavior more diligently, avoid the crowd. Final point, we know that Omicron wave is usually like a flash flood. It comes in a quick period and then disappear quickly. So as it is, cases are rising in different parts of the country, citizens need to track what is happening in their city. If cases are rising, please be careful for next 3 to 4 months. Things will be fine. I foresee that after March onward, things would be far better and we will learn better. And final point, I think one of the mistakes all Indian states are making, not opening the school. Like it's time that school should be the first thing to open across the country. There is no reason children should suffer because even though the disease does not affect them.
Right. All right, sir. Thank you so much. Thank you, Dr. Sabnis, for taking out time. I know you've had a very busy day, both of you, in fact. And thank you, Sandhya, as well, for joining us and answering all of our questions. We will be back tomorrow again with the virus Decode, where we will answer all of your questions. So do log in again tomorrow at 6 p.m. This is Mohana Basu signing out.